My name is George Tasca. I'm the research chair in psychotherapy research at the University of Ottawa and the Ottawa Hospital. I'm also the director of the Practice Research Network. I just want to acknowledge some supporters of this project, and today the Department of Psychiatry at the University of Ottawa and the Faculty of Medicine and Department of Psychiatry at the Ottawa Hospital, and the Canadian Institutes for Health Research, who are providing funds for today's meeting. So, what's a psychotherapy practice research network? We've defined it in a number of different ways, but basically we're describing it, and it is a collaboration, and the collaboration's the key word here, of a cross-disciplinary or multidisciplinary group of psychotherapy clinicians, researchers, educators, and various stakeholders who have an interest in and who are particularly invested in psychotherapy and making psychotherapy work as best as it can for the people who come to us for help. There are three main goals. I'll talk about two of them first. One has to do with advancing knowledge translation of psychotherapy research and also conducting practice-based research in psychotherapy. Now, let me just sort of describe those to some extent. So knowledge translation basically means, in this context, means clinicians informing psychotherapy research. Right? This essentially takes the research paradigm that is predominant out there and turns it on its head. It's an approach in which, rather than researchers at health sciences centers making decisions about what's going to be researched and what treatments are going to be developed and implemented, and then disseminating that to clinicians, this turns that around and basically uses clinical knowledge and clinicians' knowledge as the driver behind research questions and the way that research is conducted. So this is where clinicians have input into what questions get asked, how studies are designed, what kind of methods are used, and what kind of measures are used in a psychotherapy research study. Clinicians might participate in practice-based research in their clinical practice. That's sort of another aspect of it, and I'll talk a bit about that in a moment. And the other part of knowledge translation has to do with researchers learning from clinicians, right, about what's clinically important to research. Right? Again, it's sort of turning the typical research paradigm a little bit on its head. The other part of knowledge translation is what we're typically used to knowing about it, which is that the current knowledge about practice-relevant psychotherapy research gets synthesized in a review or a meta-analysis or a practice review, and then it gets used to inform the most up-to-date practice. And this is sort of the dissemination side of knowledge translation. What we're talking about today includes this, but largely emphasizes the exchange side of it, that people talk to each other. As I mentioned, the other aspect is conducting practice-based psychotherapy research, and that involves that's psychotherapy research that takes place in clinical practices. That asks very practical questions, that takes into account clients' complexities. This is sort of a common complaint about randomized controlled trials that are done in health sciences centers, is that maybe the clients in those trials, there's some debate about this, but maybe the clients in those trials don't really represent the types of individuals that we see in everyday clinical practice, and so psychotherapy research that might take place in a clinical practice or as part embedded within a clinical practice might take into account the fact that a number of our clients have multiple comorbidities, for example. The other part of practice-based research is that clients ask their own interesting questions, and this becomes the key part to what gets researched in those contexts. And as a result of all this, that the questions are driven by clinicians, that they occur in the clinical practices, that the patients that are in the trials or in the studies are complex and therefore representative of the types of patients we tend to see. The results, the findings from these studies should be, and in many cases are, more directly applicable to what happens in everyday clinical practice. The other side of it is the researcher side, is that the researchers would then provide the expertise that they have, right? The clinicians provide their expertise, which is the clinical know-how, whereas researchers provide their expertise, which is adequate support to do research, the design, the statistical analyses, and so on. The third goal, other than knowledge translation and practice-based research, is the tagline for our practice research network is to improve the well-being of our community. All of us are here today and have entered this profession largely for this reason, to do the best we can for people who come to us for help. And that's the ultimate goal of the practice research network in terms of developing the network. I'm not going to spend too much time on the sort of conceptual model, but it is important to think about why we're going about it in this way. And one of the things that we use to help us define the various steps that we're going through, including today, is a knowledge to action cycle, which is a knowledge translation and exchange model that is very popular within the Canadian Institutes of Health Research and its institutes. So that's what the model looks like in general, but the specifics include identifying the problem. And in our case, the problem is rather obvious, that psychotherapy research is not always translated into clinical practice. This isn't a problem just for psychotherapy research. This is a problem that you'll see in a number of healthcare areas. If you look at the literature in cardiology, cancer care, family practice, treatment, specific things like treatment of asthma, uptake of influenza vaccine, you name it. There is a clearly identified gap between what the research says and what's practiced in everyday practice. So this is not specific to psychotherapy research, but the problem for psychotherapy research is there, in that it's not often or not always translated into clinical practice. The next step of the knowledge to action cycle is to assess barriers. Again, some of these are common to various healthcare treatment areas. In our case, clinicians might believe that psychotherapy research is not applicable to what they do. And in fact, if you have, I've had a number of conversations with my clinician friends, and they'll often say this, that the randomized controlled trials are too abstract. The clients that are seen in them are too specific and not too clean, if you like. The treatments are too short and not applicable to the complexities of my practice. This is often, and this is borne out in national and international surveys of psychotherapists. And again, not an unusual situation in that it occurs also in other healthcare areas. The other side of the problem, or another barrier, is that researchers don't always consult clinicians. They're not always open to the input, and sometimes downplay or devalue clinical knowledge and expertise. Again, this is largely from some surveys, but also from my experience of talking to some of my research friends. The third barrier is specific to psychotherapy. The third one, if you're in cardiology, you have to be a cardiologist to do that, cancer care and treating other medical illnesses. You typically have to have there's one specialty that does it. Psychotherapy is different because it's cross-disciplinary, right? There are many disciplines that, if you look around the room, the people here, there are psychologists and psychiatrists and social workers and counselors and GP psychotherapists, and the list goes on, right? So this is a good thing, but it's also a barrier in the sense that people have different backgrounds, different knowledge of research, different values about research, different experience with research, and so this becomes a little bit of a problem in terms of talking to each other about what's important and in terms of translating psychotherapy research into clinical practice. The next step is developing an intervention. For us, that's a psychotherapy practice research network, which is one way of dealing with these barriers and with the problem of not translating psychotherapy research into clinical practice. And as I mentioned earlier, and we'll talk about, and Louis will talk about later, that this really involves clinicians informing research and researchers partnering and listening to clinicians. The next step is to monitor knowledge use. Do clinicians use if they participate, do they use research to inform their practice? Do researchers seek out clinicians' knowledge to inform their research? Most of you have filled out our pre-conference questionnaire package, and that's part of what we were doing there, is trying to get a sense of what knowledge is out there and what people's level of knowledge is, and also what their attitudes are. And evaluating outcomes, right? If people participate in a practice research network, do clinicians change their attitudes towards research? Do researchers change their attitudes towards clinical input? Today is an example of that. We're doing some knowledge translation this morning, the talks, the breakout groups that I'll describe in a moment. Does that have an impact on how people see psychotherapy and psychotherapy research? You will all get a post-conference survey next week. That's part of that evaluation. And the last part is does a practice research network result in sustained knowledge use? Do clinicians continue to use research to inform their practice? Do researchers continue to partner with clinicians? And that's part of our long-term goal with this, is to sustain this network, right? To have this network continue over a longer period of time as a way of continuing the exchange between clinicians and researchers so that the knowledge exchange continues. I'll talk briefly about our medium to long-term plan. Our start is today. We're doing this conference where clinicians and researchers will be sitting down together and exchanging their knowledge, their particular expertise about psychotherapy research. We'll talk, particularly in the morning, breakout groups about opportunities and barriers for a psychotherapy practice research network. In the afternoon, breakout groups will talk about defining what are the psychotherapy research priorities that are important to you. We're going to take those, the outcomes, particularly of the afternoon session, and turn them into a national survey where we're going to take your ideas from today, put them into a survey of psychotherapy clinicians, a cross-disciplinary group of psychotherapy clinicians from across Canada, and ask them to essentially rank order them. How important are these ideas that these research ideas that we're developing today to our colleagues from across Canada? And then we can do a number of things with that. We might decide that some of those ideas already have there's a lot of research out there about them. We just need to disseminate that research, and so we might do that in terms of doing some knowledge syntheses and various documents about those particular ideas, or and hopefully also take the top 3, the top 5 that come out of the today and the national survey, and actually engage in practice-based research of those particular ideas. That's our longer-term plan over the next couple of years. As I said, one of them might be to synthesize the knowledge and make it accessible to you. And again, if there's enough knowledge, we might engage in some continuing education activities related to that. So we may sponsor some workshops, for example, on some of those top research priorities that come out of today and the surveys. So that's our overall plan for the next couple of years.